Hello and welcome to Med with Sam. Today's question is types of acne and how to treat it. If you're new to this channel, welcome. I'm so glad to see you here. My name is Dr. Samira. I'm a doctor who simplifies medical concepts and makes sure that it is simple for everyone to understand. And everything that I say is always backed by scientific research. I'm going to be giving you a rundown on the types of acne, but types isn't actually the right word. The correct word is grades. To understand the grades, we do need to understand a little bit about the basics of acne, or the basic unit of acne. And that unit is called a pilosebaceous unit. So our skin all over our body, even on our face, has these pilosebaceous units. And that basically consists of a hair follicle, the bulb of which lies beneath the skin surface. And along with that, you have some glands, some sweat glands or some sebaceous glands. So sebaceous basically has something called sebum, which is essentially oil. And it functions to secrete through that channel of the pilosebaceous unit. It secretes some oil that moisturizes the skin surface. Now, in case you didn't know, our face has a lot of these pilosebaceous units because we do have hair follicles on our face as well. So, let's get back into acne. The definition of acne is now going to be very simple for you to understand because you understand what the pilosebaceous unit is. And acne is defined simply as the inflammation of that pilosebaceous unit. So, if your pores or your pilosebaceous units get clogged and then they get inflamed or infected, it's called acne. So by examining pimples in great detail, we've actually been able to identify the different stages that a pimple goes through. Grade 1 is comedones. So you've probably heard of whiteheads and blackheads, right? That's essentially what happens when our pores get clogged, and they usually get clogged by oil, dirt, sebum. Whiteheads and blackheads are called different things because the blockage happens at different levels with respect to the skin surface. When the blockage happens above the skin surface, it's called a blackhead. And when that blockage happens below the skin surface, it's called a whitehead. So what is the treatment for grade 1 acne? Basically, if you want to treat these comedones, you need to use things like salicylic acid face washes because they help to unclog those pores. And you can even use retinol for this. It's also helpful to actually physically get those pores unclogged, but make sure you don't do this yourself. Get them professionally done. They use specific tools. They will use magnifying glasses and good lighting to be able to see that pore and then to be able to physically unclog it. But that's essentially the way you want to treat grade 1 acne. Now, grade 2 is inflammation. So our pores aren't meant to be blocked. When that happens, our body tries to fight against it because it's something abnormal. So they'll send our fighter cells or our white blood cells to the spot and try to clear it. Now, although our white blood cells are very effective, and I'm very grateful for them, they do tend to cause some destruction around where they're acting. So that's what leads to the redness and the soreness that is associated with the pimple. So it's basically our body that is trying to get rid of that blockage. Now, treatment of this grade of acne, or grade 2, does essentially require a dermatologist or a doctor, can be any doctor, just to make sure that you're taking the right treatment and there are no side effects to any of this, okay? But what you want to do here is that you want to use something like a benzoyl peroxide or a retinoid cream. So you use benzoyl peroxide preferentially in the morning, retinoids at night, and then you have to use an antibiotic cream as well, something probably like a clindamycin gel. So if you've noticed, all 3 treatments are topical on top. We don't consume anything at this stage. Now, grade 3 is pustules. These are the worst. The pore gets clogged, it gets inflamed, and then bacteria who are residing in and around take the opportunity to go there and infect that area. And then when they do, our white blood cells come, and then there's this war, and then there are lots of pus cells that get formed, and you have lots of pus concentrated in a small area, and that becomes really painful, and you see that white discharge. So these pustules is grade 3 of acne. Now at this stage, your doctor might ask you to take some antibiotics to fight that bacteria and decrease all of that war that's going on your face at the moment. Now grade 4 is essentially when all of those pustules come together. Now your doctor here might suggest you to take some medications that are a bit different, and they could be isotretinoin tablets. So these tablets work by actually decreasing the sebum secretion, decreasing the oiliness, and there are multiple different ways in which they work. However, this tablet does come with significant side effects. So it's very, very, very important that you don't take these over the counter. You visit a doctor and make sure they know your entire medical history before you start treatment with this medication. So now you know the basics of acne, you know what causes it, and you know how to tackle it. Here are 5 tips that I have for you. Now that you know pores and blockage of pores is one of the main causes of acne, try to unclog them. So you can first of all use non-comedogenic products. Now you remember what comedones are. Those are the pores that get blocked. And if it gets blocked above the surface or below the surface, they're called different things, but essentially comedones are blocked pores. So use products that don't block your pores, which are non-comedogenic. Okay, now tip number 2 is try to unblock your pores. So you can exfoliate your skin by using a scrub once a week. Don't dry out your skin too much. You can also use clean bedding when you go to sleep at night so that you prevent any dirt from getting straight into your pores. Now remember, don't pick your pimples, especially if you don't know how to do it professionally, because you might make matters worse. And also, if you think you need to, visit a doctor, because they will be able to identify the grade of acne correctly and they'll be able to give you the best treatment. Now sometimes your face might show evidences of different grades of acne. So you might have like a mild grade 1 here and some grade 2 popping up here. So a doctor would be the best person to analyze what is the best combination of treatments you need at the moment. Did you learn something today? If you did, be sure to subscribe to this channel and hit the like button. I also love feedback. So if you have anything that you'd like to tell me, make sure you type it in the comments below. And if there's any other medical concept you would like simplified by me, be sure to add that in the comments below as well, and I will try my best to explain it to you. Bye bye!